Hi, I'm Viv and I'm the face behind Skinpharma Aesthetics in Stockton-on-Tees. Tonight it's the 7th of a series of weekly lives I'm carrying out with Dr. Sunny Dhesi. Hiya Sunny. Well, this week we're talking about ultrasound use in the temples. I'm just going to wait for Sunny to join me. I'll just get him. There we go. Accept. So yeah, ultrasound is something myself and Sunny both use. Hi Sunny.
Hi Viv,
Hi.
how are you?
Fine, yeah. How are you doing this bank holiday?
I was a little bit like, oh, it's bank holiday, and then I remembered I couldn't remember whether you were going on holiday or not, or whether.
It's after next week. I'm going away for a couple of weeks after next week, but still fine for tonight anyway.
Sorry, I'm not sure the connection's bad. Can you hear me okay?
Yeah, it's fine now. It was just breaking up a little bit, but it seems all right. Oh, staggering a little bit. He's still there, Sunny. I think it's just trying to reconnect. Let's see. I'll just say hi to Rachel and Ben from Clarius. Thanks for joining us. Hope you're having a good bank holiday, Rachel and Ben. I think Sunny's probably having a slight problem. Let's see. I'll join him again. I'll try inviting him again. Won't be a second. Sorry about this. Let's see if I can find it. There we go. Right. See if you can join me. Yeah, as I mentioned, this week we're talking about the use of ultrasound in our own practice, myself and Sunny's, looking at the use of dermal filler treatments in the temples and how ultrasound can be used to help us improve safety for our patients. Let's just see if you can turn up. Hi to everyone that's joining. Sunny's just having a slight problem connecting, I think. See if you can join again. Be 1 second. Sunny, there we go. Might be having a slight problem with connection. I'll see if he's going to join again. But yes, use of ultrasound can be used for many different things. We've gone through. Ooh, says he can't join. I'll send you another invite, Sunny. There we go. All right, accept. There we go. Shouldn't be too long. Yeah, facial ultrasound use in temple filler treatments. I've got some shots of this to show you. Hi, Sunny.
Hello.
It's like question time live. This trying to keep the audience happy with problems with the.
You gotta fill the gaps. I'm not sure what happened there. I've changed it to 4G. I'm not sure what's going on with the Wi-Fi, so apologies there.
No problem.
Yeah. So should we start again?
Yeah. As I was saying, tonight is the 7th of a weekly live that we've been doing, and we were going to talk last week about temple filler, use of temple filler, and how ultrasound can be used to help us as practitioners improve safety, improve effectiveness, efficacy, and also help patients become less worried about the fact that they're having a treatment in a certain part of the face. So I thought it'd be nice to do this tonight. I think last week we changed it a little bit. I think we looked at the business side of things. So we've come back to temple filler. I've got a few little shots on my iPad. I'll show those. Is that all right, Sunny? I'll let
definitely.
Yeah, let everyone have a look. So with temple filler, I don't know if all practitioners and the public are aware, but in the face, as you age, different areas of the face change. And one of those areas that do change is the temples, the areas just at the side of the forehead. And this is a shot. This isn't one of my patients. This is another patient, work carried out by somebody else. This is the effect of aging in the temples. And as you can see, there's more bony structure at the sides of the face where the temples are. Using filler, that appearance can be softened, and it can affect the brows and give a good softening of the upper forehead, of the areas around the forehead, and it can give a softer, more feminine look to individuals, females in particular. So that's the effect of filler treatments. Now,
so just with that example for people who are watching, whether they're patients or their practitioners, was that before and after sort of straight away, or was that after a certain amount of time?
I think that was some work carried out by somebody else. I think it was done. I think the aftershock might have been sometime afterwards. After there was.
So I think it's just important to clarify, because and the telltale signs of that for those people watching is that there is a lot more softening. So when we do temple fillers, obviously there's that concave aspect, that hollowing out that gives a person a skull-like appearance. Now, initially, when you put filler in, and we're going to tie this in with ultrasound now in a while, both Viv and I, is that the filler's there and it provides volume and it lifts up. So essentially, you're putting in an implant that's pushing that skin up or pushing that space out. But the great thing about filler is that it expands to about 1.5 times its normal size, and it's hydrophilic, which means it draws water into the area. So that effect that you can see in the before and after that Viv's shown is actually probably a few weeks later, and that's what you should be looking at when you're if you're doing fillers, or if you're having treatment done, is that you really want to have a review 4 weeks later, especially for this area. Now, with that one, Viv, do you know what kind of technique they use? Did they say?
I don't actually, but it's one of generally 2 different techniques that can be used with temple treatment, temple filler. I'll get a shot, a video, just so individuals can see what the ultrasound will pick up, and it'll give an idea of how the injections can be carried out. So this is, just get the scan. This is a scan I took of my one of my patients. This is a different one. Now, this is blood flow. You can see pulsing of blood, and that's within an artery. The base of the picture is bone, top of the picture is skin, and there's various different tissue in between. Now, with that shot that I showed initially, it could have been 2 different techniques that we used. Deep injection right onto the bone, which it's called gunshot technique, swift gunshot technique. So it means it's a deep injection right onto the bone through the skin, and the needle basically touches the bone, and filler is then injected onto the surface of the bone to give a lifting of the tissue above it. So that's the gunshot technique. Another technique can be involving cannula, using filler in an intermediate plane. So it's not right at the surface, it's not right at the bone end of the tissue, it's in between. So what I've got now, well, let me just show you. Let me just get it up, I'll be a second.
Whilst Viv's just getting that up, we can go on, Viv, sorry.
So this is a scan by a doctor, Dr. Stella Desiatnikova. I've just managed to pronounce the name without too many problems. Now, that is a scan that she carried out of the temple. Now, it looks like 50 shades of grey. It's very difficult to understand when you've never looked at an ultrasound scan. Top of the picture is skin, lower down is bone, and then there's intermediate tissue in the middle. Now, she's actually carrying out an injection.
Go on. So Viv, I'm just going to pause there for people. So the bottom of the iPad, so literally just above my head, is where bone is, and then at the top of the iPad is skin, essentially, or the surface. So that's what Viv's alluding to.
Yeah. Now, this is a CGI augmented version of that last scan to see the tissue more easily. What was actually being done was a cannula was being used to place filler in, let me just get it back up, in the plane. Let me just show that again. I'll just have to go through this.
I would actually just keep it on there for a second. No, keep it on that one.
Okay.
Yeah, keep it on that one, because I think, because this is moving quite fast for those people who haven't used ultrasound, or even for patients as well, clients watching. So again, at the top of my head, so just pointing up there is where bone will be. Then you've got muscle. Then you've got what I call kind of the dermal layer or collagen matrix, or whatever you want to call it. And then just a bit further up is skin. Now, as Viv has quite nicely pointed out now, and now it's all explained. So Viv, just as you were saying, where filler was placed.
Yeah, so filler in this area being placed between this, it's called, there's a temporal fat pad here, and there's tissue above it. There's skin right at the top. Filler can be injected into this plane, which gives an effective outcome. One of the issues is looking for vessels, which is the reason the ultrasound can be used to detect blood flow, which I showed in the earlier scan. There's different ways of using filler in the temples, but it's also a case of doing it as safely as possible. If you're using a deep injection, is there any risk of piercing one of the arteries that run along the temples? Is there a risk when using a cannula of moving tissue around? You've got to be careful how you do the injections.
So Viv, just as a point of that one, that slide that you're showing. So again, just going over everyone's watching, is that what Viv has done there is he's highlighted, he turns that 50 shades of indescribable grey into monotone, essentially. So, a colour spectrum. And what we're talking about is where that filler, it's come off there, Viv, but where you can see that where the red bit, where the filler was placed, is actually high up. Now, Viv, was that placed under ultrasound guided technique, or was it just placed with a needle, or was it placed with a cannula? Do you know?
I think it was cannula that was used, guided. So I think the cannula was used to actually place the filler.
Is that the cannula? Is that the cannula? That's the cannula.
Just there is the cannula moving into the area. Now this is the augmented view. Cannula comes in just there.
So if we just help you explain, so you can see that long sort of white coloured rod that's coming in, and where Viv has highlighted filler, that's actually filler being placed in under ultrasound guided technique. So if those of you watching now and sort of referring back to what we saw originally, so before it was just shades of grey, now you've got colour, and you can see that cannula there is placing the filler, and as Viv has edited that video, you can see where it's being placed. So that answers that question for anyone who's wondering, is, that's under cannula, blunt ended, so it's not a sharp kind of, that doesn't mean that you still couldn't accidentally enter an artery. And I think that's the whole point of what we're describing, what you're showing, Viv.
It's the difficulty when you're not seeing what's under the skin is you can't tell exactly where the needle or the cannula is going to end up. Even if there's little risk of hitting a vessel, one of the other issues is, are you getting the filler in the right place? Biggest problem for us is complications. We don't want a complication based on us not injecting properly or safely. And if you can identify vessels for a start, you'll hopefully minimize the risk of an occlusion or a vascular compromise, which is where the filler is pressing against blood vessels and affecting the blood flow.
Because in that higher plane, Viv, is where the branch of the temporal artery can actually sit.
So
if you go back to your scan, I mean, that where the branch, that's essentially where filler was being placed. Now, exactly. So you can see there, if you remember back to the CGI scan that Viv showed, you couldn't see it pulsating. Obviously, the software is not that sophisticated, but you'd be able to identify that there is a branch of the temporal artery sitting in that space where you want the filler to go. So just on that point about, now this is for anyone watching, is that if you're going down with a needle, you're going down to bone. So you're going to go either through something like that. So if you don't have ultrasound imaging, you're going to either go through the artery, through the other side, and that's probably less risk, although you'll probably see sort of blood spreading a little bit, whereas the artery's been punctured.
There's likely to be bruising there. But the other problem is it's not always possible to know when the needle potentially may not actually go through the vessel. What sometimes can happen, depending on the angle and the speed of the needle, you can push the artery forwards, downwards, partially pierce it and push it against the bone, and then fill into the artery when it's right against the bone. And
it's got nowhere else to go, and obviously, and because we're using such a thick product, aspirating is a little bit difficult as well. So you're really, that's why when we're doing temples, when we're injecting here, we tend to aspirate for more than 10-15 seconds. But Viv, you were just about to say that, quite rightly, pushing
it's just that the needle, even with a sharp needle, you are expecting it to pierce the vessel if you do it quickly and quickly enough and at the right angle. You'd expect the needle to pierce through an artery, but it can potentially push the vessel forwards from whichever plane it's sitting downwards towards the bone. So you could push it very gently, pierce it, and then hold it right against the bone and fill right into it against the bone. Now that's a problem which you wouldn't identify unless you were using something like guided ultrasound.
I mean, so the pre-ultrasound, because as you're wondering, so just anyone who's joined us, I think a few patients have actually joined us as well. So what we're talking today is about temple fillers. Now, if I lean into the camera a little bit, as we age, we get a hollowing, a more skull-like appearance. I'm sort of exaggerating it there with my Neanderthal brows here. So that gap here, this is a very good place to potentially inject, and as a rejuvenating procedure, which not only fills the space to avoid that skull-like appearance, but actually, if I lift here, you can see that shadows and movement. So lifting here in 3 dimensions actually improves low down on the face as well. What Viv has showed us on his iPad is a brilliant representation of his temples with a branch of the temporal artery. And then Viv, your unique work where you put together the CGI or color enhancement, and then we're just talking about the technique being used. So pre-ultrasound though, Viv, what were you doing pre-ultrasound to, because obviously you were injecting that area, so what were you doing?
With the mapping, with the vascular mapping, it's there to actually help you identify tissue, find out exactly which plane of tissue you can work within more safely, and identify blood flow. They're the main issues with tissue and dermal filler injections. You need to get the filler in the right depth, with the right amount, without compromising the surrounding tissue. You don't want to inadvertently block a vessel or lay the filler near a vessel, which can cause problems. So mapping is a way of minimizing issues before you carry out treatment. It takes more practice and skill to use guided injection. I'm still practicing doing guided injection. Practically, it can be a little bit difficult, holding the scanner against somebody's temple and injecting with your other hand. If you're on your own, it can be quite tricky to do. So it takes some practice. Generally, I think it's easy to have somebody else there with you to actually hold the device, or, when you're actually carrying out the injections, it's easier for somebody else to actually help you do that with guided treatment. But it comes with practice. I think I'm still practicing just like you are.
So I think what my question was pre-ultrasound. What do people do? And generally, what you do is you palpate for that artery using you've got the God-given tool of excellence, which is a finger, and palpating it. And we would feel for that temporal artery. Obviously, if there's nothing there, it's highly unlikely that if you can't feel pulsation, unless you've got a fast heart rate of your own, that you can feel through fingertips. And you would sort of feel along in that area. What ultrasound is helping us do in clinic is actually, like Viv just said, is vascular map. So a really important point there, which I was just listening to a podcast the other day from Dr. Tim Pearce about the complications from needle versus cannula, and that there are more. It is more common to have a complication when you're using needle, but the complications arising from cannula are much more severe. And that's where, as we get as both of us get more advanced, and I'm sure people are watching get more advanced, when you're starting to think about, well, actually, I'll start fanning some of that filler into the superficial plane, you could, the worry is you'll cause a compression. You mentioned compression, and actually, it's more than likely that a lot of what we perceive as occlusion is actually vasospasm. Viv showed us that temple scan, and obviously that was a bit more zoomed in. But zooming out, it's still a small space. You can, you know, fit 2 fingers into that area. So, you know, your thoughts on vasospasm versus, you know, what would that lead to then, and how would that look on? How would we use ultrasound to potentially detect a vasospasm?
Vasospasm, it's the vessel's basically pulsing away and starts almost like vibrating, and it's because it's being disturbed by surrounding dermal filler. Now, when you tend to see these issues after the actual filler's been injected, you'll start seeing problems. Now, with vasospasm, that's my superficial temporal artery, and that's moving away. There's no filler there around it. But with, if filler were close to the artery, it would start causing spasms. That pulsing would start moving, and it would start moving in different directions. It wouldn't stay in one position. And the position of the artery would vary along the path of that line. It wouldn't stay exactly the same. And vasospasm is the body trying to help blood flow based on the fact that there's a filler in the vicinity affecting the normal blood flow. So with ultrasound, it would be easier to actually detect vasospasm, and it would be easier to detect the fact that the filler is right there in a position that's causing the problem in the first place. With scans, filler will look like a darker area, and you can see that when you compare a pre-treatment scan to a post-treatment scan. And so it's not...
and that's the beauty of it there. You nailed it, Viv, is that when post-injection, whereas previously, especially in that small area, you would have seen compact tissue potentially, or not compact tissue. And you would see that sort of blacker area, or hyperechoic, whatever you want to call it. So darker area, closer to where you've injected, and then you know where your filler is. I mean, that's the beauty of what the beauty of what you're describing, is that you can see where the filler's sitting, and then you can see how the blood flow is altered. And that is the amazing thing. And then, go on, you say it, Viv. So you could then, how would you use your hyaluronidase potentially if you needed to?
You can basically use the hyaluronidase as a prescription-only medicine that can be used off license to dissolve filler, to break the filler up, to metabolize the filler. And what ultrasound can do is help us find exactly where that problem is, and guide. If we're going to use guided injection, we can aim the needle in the right place. So we're not just guessing and shooting hyaluronidase all over the place. We can aim treatment very specifically to treat the problem quickly and effectively. That's the whole point of doing it.
Yeah, I mean, that's good. I mean, someone may be asking, why would you inject the temples? Obviously, we've gone through that at the beginning, that it is such a good rejuvenating procedure. You know, you mentioned 2 different techniques. In jargony terms, it's called the gunshot, because it's literally pointing that needle directly in, you know, right angles, and applying a bolus or a small amount into that area. The picture, if you see it from the beginning again, the picture that Viv showed before and after, was probably a few weeks after, where the filler had expanded into the space nicely, it had integrated in with the tissues, and, you know, it creates that nice soft appearance, and also just giving a little bit of raise, as I'm demonstrating my own eyebrows, to that area. So that's why we do it. That's why we do temporary.
But doing the actual treatment and using ultrasound to help us do it properly and carefully means that we can, just like we've spoken previously about other areas of the face, we can use a protocol. So that was the purpose really of going through the fact that ultrasound is a useful tool to help us work more safely and accurately. But again, just like the other protocols that we've produced, here's a protocol for the temples. So we can follow a series of instructions and we can map the area. This is particularly for a mapping purpose. It's not for guided injection. It's slightly different because we need to do things in a slightly different way. But with mapping, we can follow a protocol, we can do things in a set way, and we can minimize problems by following a series of instructions carefully and accurately. And that's the reason we've been talking about protocols. I I think I'd mentioned to you last week, Sunny, we had a message from Leonie Schelke, who's part of Cutaneous, based in Amsterdam. She was watching our live last week, and she enjoyed it, and she said to me, Viv, it'd be great for you to have a look at some of the work that she's done. She's done research in using ultrasound technology in facial aesthetics for years now, and she's got research work that she's carried out looking at standard positions using an ultrasound scanner and following a technique to carry out vascular mapping in different areas of the face. So she sent me a couple of documents, research documents, so it was really kind of her to do that. And she said she loved our live last week, so she was happy with what we were talking about.
Well, at least we've got one fan, a very credible fan at that. Viv, I think it's bank holiday. I think we thank the people that joined us. So if people are wondering about the evolution of how we're doing this, well, we're just, this is just a discussion every week. And what we're slowly building up is what we said as our standardized protocols. And we will eventually publish those, so you'll be able to download them for free. I think that's a really good point. So maybe in a few weeks' time, what we'll switch to is actually discussing Leonie's research, and then we can tie it in with our standardized protocols. But I think we'll do a few more areas of the face, the commonly injected areas of the face. The whole face is a high-risk area. That's why we invested in ultrasound. But Viv, you have the last word. You're hosting today.
No, it's nice talking about the work that we do and what we think about it. It was just the odd little story. I think you had a couple of stories. There was one particular story, a patient I saw this week, and she came to me for mid-cheek treatment. So the mid-cheek area can, as you age, become a little more flat, and you lack shape and contour in the middle area in the cheeks. It can affect the areas around the eyes. It can affect lower down in the face. So filler treatment can be used to give a little bit of volume mid-cheek. So what I did, I carried out an ultrasound scan of the face before I did anything, checked the tissue, checked for any vessels in the area. There was no problems. Now with mid-cheek injection, you need to try and keep the injections deep, similar to using deep injections in the temples. You can go higher up. The problem is, if you use superficial injections around the cheek area, you will get movement of the filler. It looks like sausage is moving around your face when you're smiling. So you've got to get the depth right. So you inject quite deeply, and you try to get the right volume in the right place with mid-cheek injections. So I carried out the treatment and no problems at all. It was perfectly fine, didn't have any issues. And then a few days later, the patient messaged me. She said, Viv, I'm just a bit worried. I think it's moved. I think the filler's moved under my eyes, and I think it's just not in the right place. It doesn't feel right. So I said, right, no problem. Come back in. So she came back. It was only about 3 or 4 days later, and I scanned her again, had a good assessment of her face, took photos, checked her. There was no real problems. A little bit of inflammation, a little bit of redness, which is what you'd expect. So I scanned her with the ultrasound, and I looked for the position of the filler, and it was exactly where I wanted it to be, right close to the bone, not high up, not close to the skin, and it was exactly where I'd injected it. It hadn't moved towards her eye area, it hadn't moved downwards, it stayed exactly where it was. The problem was swelling. Patients worry, they wonder what's going on when there's a little bit of swelling around the area. It's quite normal, and it can make patients worry about treatments they've had. But without the ultrasound, I would not have been able to tell her exactly what had happened with the filler and whether it had moved. It would be impossible for me to have done that. So the result of that is me being confident in what I did, and with the patient, she's very happy and confident that there hasn't been any problems as a result of the treatment. So she's now happy, enjoying a bank holiday, and isn't worried about the fact that she's got a little bit of swelling around her cheeks.
Well, the fact is that you're also relaxed and enjoying a bank holiday.
Yeah.
And spending it with me doing this. So I won't tell my temple story. I'll leave that to another time. But what I will say is a good conclusion point here is, look, we have Viv's stories highlighting that he has invested in something to improve patient safety and improve the efficacy and outcome or the effectiveness of doing dermal filler treatments. So he is a medical professional, a healthcare professional who's invested in technology, and he's continually trying to, or we are continually trying to improve the service that we offer. We're not perfect, but what we do try and do is continually invest. And that's the difference between a healthcare professional who understands patient concerns, ideas and expectations, and then is able to take that and apply and offer the treatment that fits with those ideas, concerns and expectations, rather than someone walking in, well, by appointment, obviously, and then saying, I want this done, and then there's no thought or there's no structure behind what the practitioner is offering. So anyone watching, practitioners, you know, what we're saying is, you know, you keep continually investing, healthcare professionals, you keep investing in the way that you've been taught. It's the right way to do things. Don't be worried about what other people are doing who are non-medics, because what we're doing here is applying patient safety first before we go ahead and do a treatment. So Viv, I think it's just a really good one to conclude on, because you just highlighted the importance.
It is important. I think patients feel happier with the fact that you're helping them as safely as possible. And ultimately for you, it lets you sleep at night with less worry. And it's evident in my practice, that's what happens now because of the ultrasound. Yeah.
Viv, I think it's a good point to conclude on.
Yeah, no problem. I'm unfortunately away after this week because I'm training over in Amsterdam on Sunday after Sunday with Tom Van Eyck, doing dermal filler training, advanced level training with him. And then I'm off on holiday for 10 days. But I will be back in 2 Thursdays' time. So if that's all right, then we can continue in 2 weeks.
Well, I'll tell you what. If anyone's watching and they DM either one of us and say, no, we need our ultrasound fixed next week, then that means, Viv, you're going to have to do it from poolside. But
I will. I'll turn my Instagram on in Turkey next Thursday if you really want me to.
No. So it would be really good to have a little bit of a break. But, you know, if we do get a big demand, then fine. Anyone watching now, you've really got to message in and say, no, we need to have ultrasound fixed next week. So Viv will have to go live in his swimming shorts next to the poolside with his margarita or whatever he's drinking.
With my Clarice in the other hand.
With the Clarice in the other hand, with a cocktail umbrella. No, so if you DM us and you want us to do it, then we will do it. If otherwise, we'll take a break, and then we will look forward to hearing words of wisdom that you picked up from Tom Van Eyck. And I'm guessing you're probably going to meet Leonie as well.
Leonie, hopefully both of them are in Paris or due to be in Paris for IMCAS, the conference, this next few days. And I think they're both due flying back to Amsterdam on Sunday. I hope to see Tom on Monday for training, and Leonie hopefully on the evening. I think we may be going out for a meal on Monday evening next week.
Listen, why don't you try and get a few videos, just a few snippets recorded, and you can always post that next Thursday anyway. So yeah, I'll get some bits and pieces, and I'll share them next week. Yeah, brilliant. Okay, Viv. I was going to say thanks for everyone who's watching. I know that we probably had, we had quite a few. That's good. They joined us. I'm not sure how long they stayed on, but I'm sure they did. Yeah. So thanks everyone for watching. Thanks, Viv, for taking the lead on this, and those brilliant pictures, enhanced pictures as well.
No problem. Enjoy yourself and have a good bank holiday, and I'll catch you in a couple of weeks, Sunny.
Will do. Okay, take care. Bye-bye.
See ya. Bye.